This series of videos have been developed by Public Health Services. The sessions are designed to provide self-directed learning and cover the basics of infection prevention and control. This session is about transmission-based precautions. From this session, you'll have an understanding of the three types of transmission-based precautions and know when to use them. Transmission-based precautions are used in addition to standard precautions in two situations. The first is when using standard precautions alone may not be enough to prevent transmission of infectious agents. The second is where an infectious agent is a pathogen of concern in healthcare. Using standard precautions helps to prevent or reduce the risk of transmitting many infectious agents. However, some microbes that are transmitted via direct or indirect contact or via the droplet or airborne routes require an extra level of precautions to prevent the spread of infection. This is when transmission-based precautions are used. There are three types of transmission-based precautions: contact, droplet, and airborne. The precautions that are used are based on the mode of transmission of the infectious agent. Transmission-based precautions involve the use of hand hygiene, personal protective equipment or PPE, consideration to patient placement or isolation, and in some cases specific air handling requirements. In some circumstances, a combination of precautions are required. The first of the transmission-based precautions that will be discussed are contact precautions. Contact precautions are used for patients known or suspected of having an infection transmitted via direct or indirect contact, such as Clostridium difficile, norovirus, or scabies. They're also used for patients who are infected or colonised with a pathogen of concern in healthcare, such as a drug-resistant bacteria like methicillin-resistant Staphylococcus aureus. When using contact precautions, you need to wear a gown or apron and gloves when you have contact with the patient or their immediate surroundings. Remember to perform hand hygiene before and after you put on or take off your PPE. When contact precautions are required, the patient should be cared for in a single patient room with an ensuite if one is available. In addition, minimise patient bed transfers and use dedicated patient equipment where feasible. The second of the transmission-based precautions are droplet precautions, which are used to prevent transmission of infectious agents spread via close respiratory or mucous membrane contact with respiratory secretions or droplets. These are used for patients known or suspected of having a droplet-transmitted infection, such as meningococcal disease, influenza, and pertussis. Droplets produced by a patient who is coughing, sneezing, or talking are large particles that generally only travel very short distances and do not remain suspended in the air. Thus, special room ventilation is not required. When droplet precautions are required, you must wear a surgical mask when you're within 1 metre of the patient. And again, remember to perform hand hygiene before you put on your mask and after you remove it. When droplet precautions are required, the patient should be cared for in a single room. This is to prevent transmission of infectious agents between patients. In addition, minimise patient bed transfers and transport, but if this is required, ask the patient to wear a surgical mask. The third type of transmission-based precautions are airborne precautions. These are used for patients known or suspected of having an airborne transmitted infection, such as chickenpox, pulmonary tuberculosis, or measles. The infectious organisms are contained within very small droplet nuclei that are disseminated into the air when the patient breathes or coughs. These very small particles can remain suspended in the air for prolonged periods of time. When airborne precautions are required, you must put on a P2 or N95 mask and perform a fit check before you go into the patient's room. The fit check ensures that the mask is fitted correctly and that there aren't any gaps between the mask and your face. To perform a fit check, put on the mask and gently inhale and exhale. If air escapes into or out of the mask, reposition the mask and reperform the fit check. And again, remember to perform hand hygiene before you put on your mask and after you remove it. When airborne precautions are required, the patient should be cared for in a single room, preferably with negative pressure air ventilation, and the door must remain closed. Minimise patient bed transfers and transport, but if this is required, ask the patient to wear a surgical mask or a P2 or N95 mask. Transmission-based precautions are used in addition to standard precautions. There are three types: contact, droplet and airborne precautions. The precautions are used according to the mode of transmission of the known or suspected pathogen. Transmission-based precautions minimise the risk of transmission of pathogens that are not contained by standard precautions alone. This session has been based on the Australian Guidelines for the Prevention and Control of Infection in Healthcare. Thank you to the Australian Commission on Safety and Quality in Healthcare for permission to use their standardised infection prevention and control signs.